Hello everyone, my name is Kathleen Galvan and today I'll be talking about smoking tobacco cigarettes. What is tobacco smoking? Tobacco smoking is this practice of smoking tobacco and inhaling tobacco smoke. A more broad definition may include simply taking tobacco smoke into the mouth and then releasing it as it is done by some with tobacco pipes and cigars. The health risks of smoking tobacco. About half of all Americans who keep smoking will die because of the habit. Each year, more than 480,000 people in the U.S. will die from illnesses related to tobacco use. This means each year, smoking causes about 1 out of 5 deaths in the U.S. Smoking cigarettes kill more Americans than alcohol, car accidents, HIV, guns, and illegal drugs combined. Smoking shortens male smokers' lives by 12 years and female smokers' lives by about 11 years. Smoking not only causes cancer, it can damage nearly every organ in the body, including the lungs, heart, blood vessels, reproductive organs, mouth, skin, eyes, and bones. Effects include addiction to nicotine, damage to the respiratory system, decreased lung capacity, chronic cough, bronchitis, asthma, bad breath, bad taste in mouth, smelly hair, clothes, yellow or brown stains on the teeth, increased likelihood of drug use and risky behavior, and death from fire, which is the #1 cause of death from fire is smoking. Mothers and child's health. Smoking can make it harder for a woman to become pregnant. It can also affect her baby's health before and after birth. Smoking increases risk for preterm delivery, stillbirth, low birth weight, sudden infant syndrome, also known as SIDS or crib death, ectopic pregnancy, orofacial clefts in infants. Here are some fast facts about smoking. Smoking leads to disease and disability and harms nearly every organ of the body. More than 16 million Americans are living with a disease caused by smoking. For every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. Smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease. Smoking also increases the risk of tuberculosis, certain eye diseases, and problems of the immune system, including the rheumatoid arthritis. Smoking is also known a cause of erectile dysfunction in males. You can quit, and here are some benefits that you will see if you do so. Benefits that you'll notice right away after quitting would be that you'll save the money that you spent on tobacco. Food tastes better, your sense of smell returns to normal, your breath, hair, and clothes smell better, your teeth and fingernails stop yellowing. Ordinary activities leave you less out of breath, for example, climbing stairs or light housework. You can also be in smoke-free buildings without having to go outside to smoke. Here are some benefits about quitting smoking over time. The first 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. 5 years after quitting, your risk of cancers of the mouth, throat, esophagus, and bladder is cut in half. Cervical cancer risk falls that of a non-smoker. Your stroke risk can fall up to that of a non-smoker after 2 to 5 years. 10 years after quitting, your risk of dying from lung cancer is about half of a person who is still smoking. Your risk of cancer of the larynx and pancreas decreases. 15 years after quitting, your risk of coronary heart disease is that of a non-smokers. Here are some resources to help you quit smoking. Many people find that support groups and hotlines are helpful when quitting smoking. Knowing that someone is out there, understands, and shares your struggle can help you stay committed to being smoke-free. These are some organizations that can help offer personalized or listings of classes and support groups in your community. Some I would suggest is the American Cancer Society, the American Lung Association, Medline Plus, which is a stop smoking support program from the National Library of Medicine and the National Institute of Health, National Cancer Institute, National Institute of Health, Clinical Trials on Smoking Cessation, the National Network of Tobacco Cessation Quit Lines. Thank you very much for listening to this presentation, and here are my references. Have a great day.